Good morning to all panelists and participants. On this occasion, we will present our paper titled Mental Health Workforce in Developing Countries, a Bibliometric Study. Before we start, we would like to introduce our team first. The authors are Nova Yolanda Putri Sipahutar from Research Center for Public Policy, National Research and Innovation Agency, Metha Claudia Agatha Silitonga from Research Center for Public Policy, National Research and Innovation Agency, Tyas Wahyu Fadila from Center for Innovation of Public Administration, National Institute of Public Administration, Marisa Yanti Rumondang Sipahutar from National Family Planning Coordinating Agency of North Sumatra, and Suster Yosefina Itu from Academy of Community Development Saint Ursula Ende.
We will start from the background of the study. First, mental health problems are one of the biggest causes of disability globally, both from disability-adjusted life years and years of life lived with disability. The problems faced by the mental health workforce, besides the limited resources, are the lack of appreciation in the form of income and rewards and the unhealthy system. In addition, the mental health workforce is also prone to burnout, to depression. Even psychiatrists are more prone to burnout than other physicians. The mental health problems workforce in developing countries are complex. The stress level at work in developing countries is higher than in developed countries. And this study aims to describe the general trends and analysis relevant indicators from the aspects of types of articles, authors, citation, journals, countries, and author keywords of the mental health workforce in developing countries.
This study uses a bibliometric approach. Bibliometric research analyzes relationship between documents, authors, keywords, or journals. Dataset ratified from Scopus and then analyzed using the Excel program post-filler application to explore the relationship between the data and visualize the result. This chart is the protocol of ratifying data. We search data from the Scopus database on April 6, 2022. There were 91 documents with the keywords mental health workforce in developing countries in all subject areas, source title, and language. Next step, we focus our research on article, review, book chapter, book, and conference paper in English. We found 79 documents. And then we analyze publication trends, contribution of countries or authors, distribution of highly cited articles, keywords analysis of the 79 documents. The graph of publication trend informs that the first publication related to the mental health workforce in developing countries was started in 1986. Publication related to the theme from 1986 to 2007. The number of publications per year is only one publication. Later on, the number of publications are increasing and slightly fell. Regarding the number of citations, the author with the most citation is Dalpos MR, who wrote 2 articles and was cited 204 times. The country with the most citation was the United States, cited 729 times out of 22 documents. From the number of documents and number of citation, the most authoring countries are from Europe and America. The most influential article is the mental health workforce gap in low and middle income countries, a needs-based approach, cited 198 times. This article was written in 2011 by Wagner T.A., Kevler, R.M., Shen G., Yongji, Chris Holm B., Morris G., Fulton B.D., and Dalpos M.R. and Sheftar S.
The keyword overlay displays the keyword used by year. The keyword mostly used before 2014 were related to suicide and resources allocation. Meanwhile, the keywords mostly used from 2014 to 2018 were related to task sharing, well-being, mental health services, primary healthcare, and human resources. While a very new keyword, the yellow one, is related to COVID-19 and burnout. Keyword density is an analysis to determine the keywords are used most often and which are still rarely used. Research related to primary health care and mental health services related to work or workplaces is often done, while the keywords related to task sharing, suicide, and human health resources are still rarely done. As we mentioned before, the most influential countries, both in terms of citation and the number of published documents, are developed countries, namely the United States and the United Kingdom. Overall, mental health issues in developing countries are taboo. People with mental health problems should be kept away from the society because they are dangerous. The stigma attached to people with mental health problems causes people to be ashamed to admit that they or their family members have mental health disorders. The high workload is not followed by an adequate number of mental health workforce, which triggers burnout and depression. However, based on the keyword analysis results, there are not many studies that discuss burnout and depression experienced by the mental health workforce in developing countries. The availability of mental health workers is an important issue, especially during a pandemic. During the pandemic, people's mental health condition are very vulnerable and need assistance from the mental health workforce. Based on the results of the first viewer analysis, there are not many studies related to COVID-19.
So we conclude that mental health problems are severe problems and require an adequate mental health workforce of good quality. Further research related to task sharing involving two community also needs to be done. In addition, research about efforts to solve depression and burnout problems for the mental health workforce, especially during and after the pandemic, is, is also significant. Thank you for your attention.